Okay, it's a bit of a tough gig, not only third speaker but last for the whole conference, so I hope I can keep you all awake. What I would say to you is I'm going to keep this quite simple. We've heard a lot of facts and figures which are all very, very important, but sometimes they can be confusing, certainly for me, and we work with kids and we like to keep things very simple and to appeal to our senses that we've all been born with, so I'll focus quite a bit on that during my discussion. But I'll just digress for a minute if I can. I'm going to pinch a quote that I heard just the other day. It's an old one from Christine Milne, actually, who was the former Greens leader. And she made a statement. I just had some surgery on my arm, and I was actually sitting at home recuperating, and made me sit up and scream in pain. But she said, "We are a society or a community first and foremost, and an economy after that." And to me, that sums up everything that we've just talked about before, both speakers. And that is, we are about people, and government's job is to take care of people. And an economy is only one element of that. Yes, it's a really important one, but we did survive before there was money. Why do we think, and my colleague Stacey, who kindly drove today, reminded me that it took government 50 years to act after they received the first formal research that said cigarettes lead to lung cancer. 50 years. My kids love Google. I have teenagers. Google is now the Bible. You'll never see a door-to-door encyclopedia salesperson again, I imagine. You know, they tell me lots of interesting things. My oldest daughter, Sky, showed me some advertisements from the 1950s that she used for a school project. This was a couple of years back. And there was a picture of a woman holding a baby, and she was smoking. And the doctor was in a white jacket holding a cigarette as well, and they were both saying that cigarettes relax your breastfeeding experience. Wow. Then there was a 2-year-old with Coke, a toddler actually, in her drinking bottle. And I think that one was that Coca-Cola can solve all tantrums or something. It was really interesting, and I thought, is that really true? Did a bit of digging. Yes, they were, in fact, real ads from those days. The other one, though, that really always makes me smile, and we had this conversation in the car, that Santa Claus, something dear to the hearts of all our children, used to appear in green. Who do you think got him to wear red and white? Correct. And it was an extensive advertising campaign that changed even that tradition. So I guess what I would say, and perhaps on the back of Sandro's and Louise's presentations, is that individual choice can be influenced and has been, and there is a hell of a lot of money spent on it. And the reason why a government would wait 50 years to act is because they would be lobbied very heavily to say, jobs will go, your economy will shrink, and you will be deemed to be not performing as a government. So what I say to you is, how do we measure the performance of a government? And I think it's wrong at the moment, and that is why we have an obesity crisis right now. I do want to talk about a solution. I would like to say on behalf of Stephanie, who is in New Zealand or just returning from New Zealand, the answer is simple, and it is about pleasure, and a word that sometimes gets misused in the wrong way. And so you think, oh, this sounds a bit weird, what are we going to talk about here? But we are going to talk about pleasure, because that's what food should be about. It shouldn't be a business. It should be about pleasure. I'm one of 7 kids. We sat around the dining table. We had veggies growing in the backyard. My nan had an apple tree. One of the best experiences of my childhood was climbing that apple tree and then later sitting down to stewed apples at night. That was life. Life's very different now. And what Stephanie believes, and her life experience was growing up in Melbourne, well, actually, the Mornington Peninsula, everybody would be familiar with it now. It's a very different place to the 1950s, but she was incredibly fortunate to grow up in a family where they had a big property, they grew food, they had, you know, rabbits, ducks, you name it, chickens. They had a great veggie garden, and she had a grandfather who was, I guess, the father figure of the family, because her dad was a parliamentary secretary and often spent time in Canberra. Mum was a very creative cook, and can you imagine somebody in the 1950s in Australia putting Japanese food on the table? It was really rare. But Mum didn't travel so much. She travelled through the food that she presented to her family. So Stephanie did grow up with quite a diverse eating, you know, experience. But it was all about the freshness, and what was available in the backyard, or what was available seasonally, was what the stimulus for the meal was all about. So when she, like most of us, despaired at the growing reporting of the well-being of Australians and in particular children deteriorating, she decided that there has to be an intervention that empowers children, that engages their senses and gives them an alternative experience to what they're seeing on the TV, what they drive past down the street, and what perhaps is in front of them many hours of the day when it shouldn't be there. And that's where the Kitchen Garden program was born from, that very desire to say, let's try something different. Okay, so as you can imagine, if it takes a government 50 years to act on cigarettes, how long does it take them to act on food education? Well, we're still trying, but we have had great government support. We've been really fortunate. And the reason we have had that support is that Stephanie and myself have sat in front of a lot of politicians, but the biggest question we've asked them is, will you come and sit with 8-year-olds and see what they're eating? And they say yes. And they're blown away that 8-year-olds actually not only devour salads and fresh seasonal food, but they actually are really proud of it. And these kids are basically growing their own food, cooking it and eating it. It's so simple. Now, no, we're not suggesting we turn our primary schools into edible, complete edible schoolyards. That's not possible. So what the kids get is a taste, they get an experience of it. But most importantly, what we do for the teachers, who are very busy people, as we all know, and under a lot of pressure, we give them educational resources to show how you can do maths, literacy, history, science, all around food and all around gardens and kitchens and then back in the classroom. So we call this an integrated program. It's a win-win. And I guess, as I said at the start, I'm going to talk about simplicity. That is the simple solution from our perspective. If you can make something a win-win for people, it will work and it will succeed. So I joined Stephanie 10 years ago. We had one school and two sort of limping to get started. The barriers were unbelievable. The sorts of things that the education department would say about why would you even have a kitchen in a primary school, and no, you can't have gardens and kids could get germs and they might cut themselves, and on it went. Legitimate for sure, but I guess the fear came first, not the possibility. So we had to show the possibilities and the opportunities, and that's what we did. 10 years later, we now have 10% of all Australian primary schools doing this program. That's 837 schools around this country. And I have had the pleasure to visit many of these schools and sit with 8 to 11-year-olds and see how they feel about food. And for me, it's delightful to go back to that early childhood experience of myself, to sit around a table and actually share what is the greatest connector of communities, and that is food. And we talked in the introduction there, it was mentioned about the diverse communities. This program, could you imagine that there's a kitchen garden program in Obesity? Anyone been to Obesity in the room? It's pretty sparse. It reminds me of the moonscape. And it's extremely hot. But they are growing food and veggies in Obesity, and they are doing an amazing job, and it is one of the best programs I've ever seen. This program is on the Tiwi Islands. It's in many remote Indigenous communities. It's in many rural and regional areas. I had the pleasure of going to Ararat North Primary School in the early days. They're doing really, really well. In the metro areas, in places like Sydney and Melbourne, I remember going to Bondi Primary School, which is what we call a demonstration school, one that others can learn from. And they had no space. And they said, we really want to do this, but we don't know what to do. So they ended up deciding that part of their asphalt could become, no-dig sort of garden beds, and they did it, and they made it happen. And I could tell you so many stories of how schools have had to fight bureaucracy themselves to say, our parents want this. Our parents believe that education should include the knowledge of food and why food is important for our survival. And by the way, kids learn better when they're eating good food. We talked, Louise, I just wanted to refer back to your comments about the dietary guidelines and the traffic light approach, which is, for me, it's really confusing, I have to say, and something that we debate at the foundation constantly is the olive oil and the butter debate. And what I would say is there are good fats and bad fats, and that's the sort of education we need, not how many grams. I mean, the word nutrition does not stimulate me, I have to say. No offence to any nutritionists in the room or dietitians, but it does nothing. But talk to me about a fresh, crunchy, yummy salad, you got me. So it's about how we educate and communicate. And if we think about those food standards, all right, sure, margarine rates as lower than butter, but there's a lot of chemicals in that margarine there. So what else is it doing to me? And would I go and really have a whole bucket of butter in one taste? No. We were taught that you scrape your butter on and you spread it thinly, and it's a beautiful taste. And that's the other piece of education that we need to get back to, is moderation and understanding that there's different kinds of foods. Some are good for you, some are bad. It's not about what the label says, it's actually about what you should know inherently, and that is if it comes from the ground, it's going to be pretty good. That's one certainty. And also, if it's sitting in a supermarket and it's not coming out the ground and hasn't been for 6 months, it might be old. And how many children now, in our program, we get so many great stories from parents and teachers where the kids are lobbying their parents on what to buy. That's change. For children to say, we want kale, and for their parents to go, what is kale? And the kids go, I'll show you in a meal tonight. Let's buy some. And so at the moment there's about 100,000 children doing this program. Since we've started, there's probably a couple of 100,000 that have already gone through the program. The sorts of results that we've had from our formal evaluations show that not only are children wanting to try new foods and go home and have these foods in their life, they're also looking at how that will shape their lives and what they want to do with themselves. So we see kids talking about careers. One classic, I have to say, I went to a rural school and there was an aquaponics set up there, and this young boy, Stephanie, said, what do you think about the Kitchen Garden program? He goes, what do I think about it? I'm going to become a chef. That's what I think about it. And we thought, oh, yeah, you hear that. Then he talked us through how he's going to get to become a chef. And it was a step-by-step plan. And we hear that time and time again, and that's really exciting. That's a flow-on effect. But the other flow-on effects we see are schools stopping fundraising with chocolate and starting fundraising with seedlings. Or not having a white processed piece of bread and tomato sauce, and a sausage at the sausage sizzle, but maybe having some pita bread and fresh lettuce with that sausage. And again, it's coming from the kids. They're the ones who are saying, we can make this change. And so that is our job, is to work with children. So if we talk solutions, what is the right solution? From our perspective, it's let's inform people in a way that they can tap into their own instincts and rely on their own senses and make the judgments for themselves. And if you think about the fact that, as Sandro said, and I believe the figure of advertising or marketing spent by Coca-Cola, Stace, you told me this on the way up again, was it 1.5 billion? I think over a period of time that Coca-Cola spends, Coca-Cola Amatil. Think about what you could do with 1.5 billion in food aid. That's a hell of a lot of money. So I guess we need to, first of all, empower the younger generation, because they are the ones who make change. They become the best advocates in the world. We are talking to government. Our good friend Jamie Oliver, does anybody know that Jamie Oliver's launched a petition around food education? Yep. So he came to us just when I started with the foundation about 10 years ago, and he came to Collingwood College and he bought the 15 restaurant apprentices. You probably remember that the 15 concept. It actually didn't work in Australia, and that's a whole other story. I won't talk about why, but he brought those apprentices into Collingwood College and they worked with 8-year-olds, and his comment was in the middle of it, he's quite a character, God, these kids know more than my apprentices, sort of thing. And we said, well, they're doing this every week. And so over the time, and then over the the following few years, we shared our knowledge with them, and he's really convinced that educating children about food at school is the way to go. So that's why he's launched the petition, and we think good luck. And Stephanie and I were at the Opera House to see him launch that. He had children from one of our schools on stage cook with him, from Bondi School, and it's so exciting. But for us, to get government to change, we are up against the economic equation. So the conversation that we often have is, if we invest today in a very little amount, we will save so much money in the future. And one thing I guess that also I'm very passionate about is, why should we wait till something becomes a problem? We're smart. Aren't we an intelligent race? Don't we know that if we work early in prevention, we don't have to let it become a problem? It is a problem. And I was interested in Louise's comments around BMI. It's always really, fascinating to understand where these measures come from. But I've sat in so many forums, both here in Australia and overseas, around obesity and obesity-related illnesses. And the common theme is this, that it's not stopping, it's not slowing down, and we need to do something. Recent research came out about 2 weeks ago, I think, and it was talking about the debate of physical activity versus diet in relation to obesity. And the result was that they now believe that overwhelmingly 99% of the factor is in our diet. In Australia, food education, particularly for schools, Our program is one. There's not many others out there. We've been funded by the Australian government, by the previous government. We're not going to be funded going forward by the government, despite many attempts to secure that funding. Australia is putting $100 million into sport. So Australia's gone with the physical activity side, dropped the food education side, yet research is showing we should be doing the exact opposite. So we've still got a lot of work to do. Maybe you can all become activists and knock on someone like Louise's door and members of Parliament's door and say, come on guys, we're a smart country, we're innovative, let's get on board here. This is simple. It's going to actually improve the kids' academic outcomes because an engaged and interested learner, as we know, performs even better, and that is overwhelmingly what we hear back from the schools. So we would love support in that regard. The last piece I would say, I better check in. How are we going?
Sounds good to me.
Oh yeah? A little bit more? Yep. Okay, great. Last thing I would say is that our program, I'll just give you a little bit of how it works, you know, in reality. So as an organisation, we work with teachers and schools to train them and give them educational resources to deliver this program. So the kids spend a lesson every week or fortnight. They'll go into the garden and they'll do everything from your very mundane weeding, watering, composting, seed saving, harvesting. They do the lot. And then they will go into the kitchen once a week or once a fortnight and they will cook a meal together, and then they will come and sit in a group around a table and they will share their food. They will help themselves to what it is they would like to eat. No one says this is your plate of food, it's theirs, they select. No one says this is healthy for you, no one. Our philosophy is engage their senses. The best food is the freshest food and they'll love it. And because it's theirs, they feel pride, self-esteem goes up, and they choose for the best possible reason, not because of any other influence, but their own instincts. And that's what we want to see. So that program has been working in primary schools. As I said, we're in about 10% of Australian primary schools. What we've decided to do to keep ourselves going, as well as reaching out to our partner in Medibank, we've also opened a membership. So any early learning centre, primary school or secondary school in this country can now join. It's a $150 joining fee. It's nothing. We want it to be accessible. We want this knowledge to spread, and we want to do ourselves out of a job, which is not very common for a lot of not-for-profits, but we hope we can do ourselves out of a job very quickly. The sooner this knowledge grows and is embedded into schools, the happier that we think we'll be, but also the healthier we think Australia will be. So thank you. It's really fantastic to be here to have a chat with you, and let's create some controversy now, do you think?